Ovarian cancer symptom recognition. Most patients with early ovarian cancer will describe non-specific abdominal symptoms like bloating, a sense of fullness, mild discomfort, nausea, or early satiety. In addition, some women may complain of a change in bowel habits, urinary frequency, or urgency. For this reason, NICE guideline about ovarian cancer advised to measure CA125 based on symptoms in the following three scenarios. The first scenario is a woman, especially if over 50 years, complaining of one of the following symptoms: persistent abdominal distension, referred to usually by women as bloating, early satiety or loss of appetite, pelvic or abdominal pain, increased urinary urgency or frequency. And these symptoms are persistent or frequent, especially if more than 12 times per month. The second scenario is a woman presenting with unexplained weight loss, persistent fatigue, or change in bowel habits, such as constipation or diarrhea. And lastly, a woman over 50 years with new onset irritable bowel syndrome like symptoms within the last 12 months. Because irritable bowel syndrome rarely present for the first time in women over 50 years. If CA125 less than 35 international unit per mil, then assess the patient carefully for other clinical causes of her symptoms and investigate if appropriate. If CA125 is 35 or more, then proceed to pelvic ultrasound, transabdominal and or transvaginal. If ultrasound is normal, then assess the patient for other clinical causes of her symptoms. And if no clinical cause is apparent, advise her to return again if symptoms becomes more frequent and or persistent. If ultrasound is abnormal, I mean there is ascites or pelvic abdominal mass, then the patient should be referred urgently within 2 weeks to specialist gynecologic oncology service.